The high proportion of critical incidents involving people in mental health crisis and the lack of adequate training for police officers on how to respond. A critical incident is a police operation that results in a death or serious injury. According to a report by the NSW Law Enforcement Conduct Commission, almost half of the people involved in critical incidents with NSW police over the past 5 years were experiencing a mental health crisis. This means that police officers are frequently encountering people who are distressed, vulnerable, and potentially violent. However, the report also found that police officers receive extremely limited training on how to deal with mentally ill people in crisis. Only 300 of the 16,000 sworn officers are trained each year in a 4-day mental health intervention program that teaches them how to recognize, communicate, and de-escalate complex mental health situations. The report also noted that the Police Ambulance Clinician Early Response (PACER) program, which allows mental health clinicians to assist police officers on the scene, only operates in 1/3 of police districts and for 8 hours a day. The lack of adequate training and support for police officers on how to respond to people in mental health crisis has serious consequences for both the officers and the people they interact with. The report highlighted several cases where police officers used excessive or inappropriate force against people who were mentally unwell, resulting in death or serious injury. For example, in 2020, a man who was suffering from schizophrenia and bipolar disorder was shot dead by police after he stabbed his mother and threatened them with a knife. The report found that the officers did not attempt to communicate with the man or use less lethal options before resorting to firearms. The report also pointed out that police officers themselves are at risk of psychological harm and trauma from being involved in critical incidents, especially when they involve people in mental health crisis. The report stated that police officers often experience guilt, anger, sadness, and anxiety after such incidents, and may develop post-traumatic stress disorder or other mental health issues. The report recommended that police officers receive more support and counseling after critical incidents, as well as regular mental health checkups. The report concluded that there is an urgent need for better mental health training and resources for police officers on how to respond to people in mental health crisis. The report urged NSW Health to better fund and expand the PACER program, and NSW Police to increase the number of officers trained in mental health intervention. The report also suggested that police officers should work more closely with mental health services and community organizations to prevent and manage mental health crises before they escalate into critical incidents. The report stated that improving the way police officers respond to people in mental health crisis would not only reduce the number of deaths and serious injuries, but also enhance public trust and confidence in the police force. The report said that by treating people in mental health crisis with respect, compassion, and dignity, police officers can help them access appropriate care and support and potentially save lives.